I'd like to thank Mrs. Chu for sitting in here for the ranking member, and I would like to thank all of you for being here today, taking your time to discuss with us such an important issue. Being from southern West Virginia, which is a very rural district, my top priority is making sure that my constituents have the best access they can to quality health care. In 2020, I was absolutely thrilled that the House passed the No Surprises Act to help patients all across the nation to deal with their medical bills, especially in rural areas, because many patients don't have much of a choice about where they receive their care, and this policy was a huge win for patient-centered health care. So you can imagine my surprise when I learned just how wrong the implementation of this bill has become. One concern I have about the No Surprises Act implementation is that Congress was very clear that ground ambulance services were not included in the NSA. However, I understand that some insurers are telling customers that ground ambulance services are subject to NSA. I would like to note that the failure of CMS to issue a clarification is creating real problems. Rural ground ambulance services are particularly harmed because they are often small companies or businesses with very limited resources, and many are struggling just to keep their doors open. Reports that some insurers are trying to force these rural providers to use the time-consuming and expensive IDR process when they aren't even subject to it, nor do they have established qualified payment amount. This is concerning to me, and I am dismayed that CMS hasn't issued the written clarification that would solve this confusion, and I hope that this is an issue that we will continue to keep an eye upon. Dr. Bleier, I would like to thank you for your hard working providing emergency medical care to rural patients. In rural areas where access to care is so often limited, it's important that patients who are seeking medical treatment, that they can do it without the fear of a surprise medical bill. One issue that we hear about time and time again is the lack of staffing available in our healthcare workforce. In rural areas, it's becoming harder and harder to find physicians that are willing to practice where their reimbursement rates are so much lower. This is due to the coverage mix of their patients. Can you speak further about how compliance with the NSA, as implemented by this administration thus far, has contributed to physician burnout in your workforce, and how this might influence physicians looking to start their careers in rural areas?
Yeah, I appreciate the question. I think physician burnout is very high among emergency physicians for a wide range of reasons, going back toward the COVID pandemic. And emergency, I believe it's the highest burnout right now out of any of the specialties based upon some of the recent polls that I've seen, unfortunately. It's a little bit of moral hazard right now. Our physicians always want to do right by their patients, and we try to do the best we can, and we're used to working under very adverse circumstances, but due to a wide variety of issues, including workforce-related issues, boarding, workplace violence, these are all issues that emergency medicine providers and other emergency medicine workers, nurses, et cetera, have to deal with in the emergency department. From the emergency medicine physician and nurse practitioner and PA perspective, when our resources for a group like ours are fully debilitated. Again, we were shocked when we found out when this law was passed, this bipartisan piece of legislation. We thought it was a great advancement. We did not think we would be affected by it because we had been in network with all the major payers in our region. But then we were kicked out of network. And it's like putting salt in a wound, quite frankly, for us, because not only are our providers working as hard as they can to do the best they can under very adverse circumstances, but when, on top of that, their reimbursement, their fair market reimbursement is cut, it makes it very damaging to them. I think their psyche. I think it puts us in a very difficult position, and we want to do right by the patients. We want our resources not having to go to an IDR process. We want them to go towards our providers working in the emergency department to provide the very best care they can in these rural emergency departments or any emergency department we work at.
Thank you. I yield back my time.